Hi, my name is Linda Sisk, and I've been a hygienist over 30 years. And I was going to show you my way of polishing, but if you were to talk to every hygienist, you might find something a little bit different that they might show you. But I can give you some helpful hints on not pinching and cutting and different things like that. So let me go ahead and first, I always look around in the mouth anyhow, just to make sure that there's nothing lodged or food that might be caught in between the teeth and the tongue, of course, doing the oral cancer evaluation and looking. But so now we'll go right into the polishing. When I'm going to do the lower right quadrant first. And so we're going to get a little of the paste. And what we're going to do, as we can see real well with the light, the way it's adjusted right now, we're going to go up and go towards the distal and go towards the mesial. And sometimes you can't even take a little paste and cover maybe 3 teeth, just kind of get it going, you know, just to get you started first. And then you can just kind of go right into it. But let me warn you that if you get too much paste, like a big glob of it, okay, and you go full speed ahead, you can either traumatize, lacerate the tissue, you can hear it. Sometimes you could even lose control of it. So when you're holding the prophy angle, as they said, like in a V, you're going to be holding it in the V of your palm, like a palm grasp. You're going to be holding your fingers, like your ring finger, index finger, thumb. I do that to make sure that I have good control. Plus, you'll see me using my 4th finger to kind of fulcrum, and I'm using my index finger on my left to pull down the cheek a little bit. A secret here too is to make sure that the patient is not completely stretched like this, which tightens in here and makes it a lot harder to polish. So just have them relax a little bit, and you'll see that you'll get some extension here. Makes it easier. The muscle kind of relaxes a little bit better. It will help you in seeing and going around. And I do want to say, do not go full speed ahead. It burns. You could really hurt the patient. You can hear the sound. It's almost like a torture. So as we go around, you can have them turn a little bit. And I do need the mirror. I forgot. Okay. So you're kind of coming around interproximal. You can have them turn back even a little bit. Make sure that you get the distal or the cuspid here. So you can visually see pretty good on the little anterior here. But I'm always usually holding the mirror too. Okay? So you'll rinse out after maybe using a quadrant at a time. Okay, so you can see again, they need to close down a little bit. If you stretch, you're going to miss it. You're going to be fighting them. You could pinch the cheek. You could be hitting them. Make sure your fingernails are not long, because you never know when you can cut into the tissue. And when you're trying to get a good fulcrum, it hurts. Sometimes, I mean, I love pretty nails, but you got to really consider the patient. So with them closing down, and I always, you know, you can use a little Listerine on your mirror and it'll help to focus better, and with all the breathing that's going on. And so you can see in the mirror. And remember, like I said, you can get a little bit of paste and go along a little bit more. And again, if it's too long like this, you will not. You will be fighting, they will be fighting, it'll hurt. Close a little bit. And you usually get a good view. You kind of come up the middle, make sure you're kind of going to the mesial and the distal. And if you need to, then have them adjust a little bit to the left. Again, have them close down. You can even see the distal.
Linda, how much, where should you place the prophy head when you're about to start? How many, how, as far as placement, is it on top of the gingiva, below the gingiva?
You want to put it right at the gum line. You can move in towards the sulcus, but you do not want to be going so deep into the gingiva that you could cut.
Okay.
And in some cases, you know, if you're gentle, you could get just a little bit right around the margin to make sure you are getting it. But most of the time, they say to go in, I think it's like 1 to 2 centimeters in towards the sulcus area.
Okay.
But as you can see, what I did a while ago, and I don't know if you can see how I hurt the tissue right here. I cut in, do you see that?
Mm-hmm.
Because I got too low, which did cause trauma to the tissue. So you've got to be very careful. And like I said, I had them stretched open real big like this too, and I'm fighting, they're fighting. So close a little bit and gently pull the lip down.
Okay, so could you show us the anterior buccal?
Mm-hmm.
I mean, excuse me, lingual.
Okay.
Because some students have asked me, what about when we get to the lingual part of the anteriors?
Okay. Oh, the lingual part here?
Mm-hmm.
Oh, this is really pretty easy. So you'll move the head straight. You can position yourself to be looking at them more forwardly. You can bring them down just a little bit and angle it. And this is where you need your indirect vision so that you can see it. And you'll angle. If I can bring this down a little bit more. There we go. Which gives me a little bit more leeway with the prophy angle. You can see it beautifully in the mirror. Okay? So therefore, you'll have to use, and come up. You can still turn towards the, and you know what happened just then, girls? Guys, I did not have a good fulcrum on that area. So you know what was happening? It was kind of flying around. Do you see that? Because I wasn't controlling it. I was either too far back with the prophy angle, like a water hose. It just kind of did its own thing. So hold it close to the prophy angle. Get a good fulcrum, kind of right on the cuspid here, and gently put it up at the margin area and come up. You can turn a little bit. And always have that control, because like I said, it's very easy to lose it. Make sure, and that's why you do not want long fingernails, and you want to make sure it's just not so wet.
Awesome. Can you show us, go ahead and demo for the occlusal?
Okay, all right. Okay, we'll go towards the back because that's always kind of a difficult area too. Again, if you stretch so big, you got to be careful. Okay, like for the distal of the number 32 here we have, you'll be fighting it. So just a little bit towards the back. You can open a little bit more. You're going to get into the pits, little fissures here, and just kind of, you may be using a brush, which will allow you to get in there, but at my office I use the Prophy angle too. I'm going just a little bit faster to get into the crevices there, but then we can get a nicer pace of a regular speed here. And as you see, the Prophy angle does flare out, which makes it real nice. So you can pretty much see everything in the mirror.
Yeah. When you do the incisal, the occlusal, the incisal, the edges, how is it? What do you do there? You just
kind of just barely go, or when you're coming up, you see how that leads over?
Okay.
Same way in through here.
That was another question one of the students had about the when you get to the anterior.
You can just kind of come over the edge here. You can see that it flares. If you want to come a little bit across the top, you sure can too. But a lot of times, as we're coming this way, and then we direct from the lingual view, and we come up, it hits it. Now, a more difficult area may be your left side. So you may want to position yourself a little bit better towards the side. Have them maybe turn a little bit to you. Okay. And you can see in my mirror again, I am using the mirror a lot because that gives you a good view. And again, closing back here a little bit so that you can get in the back. Because watch when I open all the way. It pushes. See how I'm fighting the cheek? You can pinch it. It can hurt. Before you know it, your nails could get into here. The mirror can get cutting down here, trying to see. So have the cheek. Close it a little bit. You can even practice on yourself. And this is what I show a lot of my patients. If you put your finger up here, but you have the patient open all the way, it pushes my finger out, and you miss these teeth completely, here and here, because the fold of the cheek goes. So it's real, instead of fighting it like we were taught years ago, have them relax. And so you can turn them a little bit to you, where you can see, and position yourself in your chair to the side, and do the same thing. You're going to go down the middle. You can go to work yourself towards the mesial here, and then the distal, and you're even able to get behind the distal of either 15, 16 sometimes.
Linda, let me ask you, are you, when you're doing the coronal polishing, are you lifting, when you're doing the middle, then the mesial, then the distal, are you lifting your Prophy
I am lifting
just a little bit?
Yes, I sure am.
Rather than
right. Because too, sometimes you may need a little bit more pace, but it's also given you where you can direct the Prophy angle towards the mesial or towards the distal.
Okay.
Otherwise, it's kind of like doing it halfway, to be honest. It'd be like this. And remember, when you're working on the anteriors up here, again, close a little bit, retract, put the brush right barely up to the margin here, come straight down, move over towards the distal, and you can hit the mesial. It will give you better control by lifting up.
Okay. And in between all of this, of course, you are rinsing.
Most definitely.
Rinsing and suctioning. And
it's a real good idea to rinse after maybe doing a quadrant.
Okay.
that's kind of nice because it does get real pasty. I do not use a lot of paste.
Okay.
Sometimes it's very difficult to know your speed, and then you can cause a lot of abrasion. And also you can kind of burn the surface because you don't know how thick that paste is in working down on the enamel. So I do not use very much so I can see. Now if there's some stain, I may put, just a little bit more. I may go over the tooth a couple of more times.
Okay.
And then if you want to get the left, again, I know they show you can either use the mirror for the indirect vision, or you can hold the tongue back, and you usually have the reflection of that stainless, and you can also
that's a good point.
You can see, and it keeps the tongue. Just be careful, that when you're retracting that tongue that you're not causing any harm.
Awesome. Any last minute tips that you want to just give the students on this before we move on to sealants?
Okay, just make sure that they're relaxed. Okay, even practicing on yourself. Stretching causes damage. You can do the nails. You can burn. And as I was telling Carmen over here, first name, sorry Carmen, that it's like a water hose almost. And if you're polishing like this, do you see how it has a mind of its own? There's no control. You have no fulcrum. You have no rest. That's so important. And it also relaxes your wrist where you will not be hurting.
Now, how important is the light to you, Linda?
Oh, the light is so important because as you can see, I would be missing so many areas, and I'd have to be bending over the patient. That might get a little intimate. And so I constantly am adjusting the light for whatever direction that I need.
Thank you so very much, Linda.
You are welcome.